my name is Brooke Showalter, and I would like to talk to you about the use of stop signs in the emergency department. Have you ever visited the emergency department? Well, if you haven't, I'd like to take a minute and tell you about mine and the one that I work in. On average, we see in a day 300 to 400 patients. On busy days, we see 500 to 600 patients. We have an 81-bed facility, which consists of 5 fast-track, 31 intermediate beds, 36 acute, 7 holding, and 2 trauma bays. This is a picture of what our exam rooms look like. In the upper left-hand corner, you will find our acute area, which consists of a glass door and a privacy curtain. In the lower pictures, on the right and left, you will find what the first one, which is kind of self-explanatory, is a wooden door, and our other intermediate area is just a privacy curtain. So now what I would like you to do is take a minute, close your eyes, sit back, and imagine being in one of these rooms. As you're sitting in one of these rooms, the doctor tells you, look, you have to have a procedure done, you're having all this pain, you don't feel good, we have to figure out what's going on. And he says to you, we're going to straight cath you for urine, because we think this might be where the infection's coming from. So there you are, you're sick, you don't feel good, and you decide, okay, yes, this is what we need to do. I don't feel good, I want to feel better. And the doctor's convinced you that this is what you need to do. You're laying there, you're all upset, you're getting ready to have this procedure done, you're exposed from the waist down, all private parts, and as you're getting ready to have this procedure done, there's a knock on the door. With that knock, nobody says come in, nobody says proceed, somebody flings open that curtain and comes barging in. There you are, completely exposed. Your body parts are now exposed to anybody walking in that hallway, family members, patients, other patients, doctors, nurses, other staff, x-ray techs, all walking around, and now you've been completely exposed. Wouldn't it have been easier if there was a stop sign outside that door so people would know not to come in? Why use a stop sign? Prime example, it makes people think before entering. Patient's privacy is number one. Make sure that patient feels that their privacy has been protected. Another reason is for sterile procedures. Sterile procedures, you cannot cross that sterile field, because if you do, then it minimizes their chances of infection. It is to help keep a patient, while a procedure is being taken place, a patient's body is exposed. So you want to put the stop sign out there so that people know that something's going on in there. And it's to keep staff and other family members out while a certain procedure is taking place. Those procedures that take place may take a maximum 15-20 minutes that you wouldn't be able to be with your family. A sterile procedure is a procedure, an invasive procedure, that is done in a sterile field to reduce infection to a patient. Some of the sterile procedures that we do on a regular basis are urinary catheters, straight catheters, A-lines, central lines, things of that nature, where you want to create as minimal infection as possible to the patient, because usually when you're getting these things done, somebody is really, really sick. If when you're doing a sterile procedure it's not done in compliance with sterility, then like I said, infection can set in and cause serious health problems to the patient, which sometimes can even cause death. As you can see in this picture, hats, gowns, gloves, masks, which are all sterile, are to be worn to protect the patient from infection. And a final thought. Happy patients. Not everyone knocks before entering a room, and those who do don't always wait for a response to come in. They just barge in. I'm taking you back to that moment when you were sitting in that room. Now, what if we could minimize the flow of traffic into a patient's exam room by putting a stop sign outside the door while a procedure, whether it's sterile or not, is taking place? We could in turn get happy patients who feel respected, cared for, and dignified because we kept their dignity. So think about it. The next time you're in a hospital and you see a stop sign, make sure you stop, knock, and think before entering. Thank you.